Hey everybody, welcome back to Living Traditions Homestead. Well, we have an adventure to take you guys on today. We actually have to take two of our cows, well, our cow Babe, our dairy cow, our Jersey cow, and her calf Ralphie to the vet.
Now Babe has some routine work that needs to be done for her. Her feet need to be trimmed. Now it's very common, especially for dairy cows who are eating grain, their feet or their hooves grow, too long, and from time to time they need to be trimmed up. And so that is her appointment at the vet today, is to get her little dairy cow pedicure.
And for Ralphie, well, he's got a different thing he needs to have done today. We're going to be taking Ralphie in to be castrated today. Now, we won't be showing a whole lot of that on the video because we know that that's not something everybody wants to see. So Ralphie will be going along and we'll be talking to the vet. He's going to be on camera with us, kind of telling you what's going to happen and all of that. And then, but we won't be showing a lot of the actual procedure. So don't worry about that. It won't get too graphic. Now, normally we castrate our young bull calves ourselves, and we were actually going to castrate Ralphie ourselves like we normally do, but he is growing so fast that he is actually already too big for the bander that we have, and he's not quite big enough for the extra large bander. So we've decided that as long as we need to take Babe to the vet anyway, we might as well just take him along and have the professionals do it this time.
Now I think Ralphie is growing super fast because our beef calves that we castrate ourselves are generally older than Ralphie is right now when we castrate them, and we haven't had any problems. So I think it's the rich Jersey milk that's just making him grow so quickly. But we are very thankful that we do have the option that when we need to take Babe in for her pedicure, that we can just bring him along in the trailer and they can help us out with that.
Right. We actually have a great vet here in our small town. His name is Dr. Mike Peters. That's where we're going to be going today. He is excited to actually share some information with you guys as well, so that is awesome. We actually have an appointment for early this afternoon, so we are going to get Ralphie and Babe loaded into the trailer, and then we're going to bring you guys along with us as they get their procedures done at the vet.
Three feet. Keep coming, 2 feet. Stop. I think that's good. I think that's perfect. Yeah, Ralphie can go too. Go on, Ralphie. Good boy. Good girl.
Come on, Ralphie. Good girl.
Good girl. Good boy.
Good job. Good girl.
Good girl. Let me go. Go on. Go on. Good girl. Go on. Good girl. Go on.
Go on, Ralphie.
Go on. Go on, Mama. Good girl. Pat her booty.
Go on, Babe.
Good girl.
Good girl, Mama.
Go on, Ralphie.
Go on.
Good boy.
Good
Okay,
boy.
shut it.
All right, they're in the trailer. Let's head for the vet. Well, we made it into town. We're at the vet's office. He hasn't come out just yet. We let them know that we're here. As soon as they come out, we'll get Babe and Ralphie unloaded, and then we'll start asking the vet some questions about everything that we need to know.
The ride went smoothly for Babe. You know, she's never been off of our homestead.
Right.
She was born there, never been in a trailer before. So overall, we're really pleased with how well she did. I think she's gonna do great.
there. Yeah. We're going to close that.
Yep, good.
Seal everybody in here.
All right, well, we made it. They got unloaded. Everybody's safe. Looks like the trip went pretty smoothly, other than some diarrhea in the trailer, but that's pretty normal. We're here with Dr. Mike, and he is going to give us kind of his first impression of how Babe looks, and then we're going to talk a little bit about, I think, some of the things that maybe homesteaders in general need to know or should know before they buy a dairy cow.
Fair enough. We see a lot of new beginners with dairy cows that are moving and want to raise their own beef or their milk, and you know, sometimes it's fun to jump in these things, but not always knowing what they're getting into, and just having some client education. The veterinary clinic is definitely a good place to start. And she's you said this is her first calf, right? So this would be her first lactation. She's a Jersey cow, and one we call it first calf heifer in that term, although she's now officially a cow. But one common thing that people that are in the beef industry or used to beef cows is that they think a lot of these dairy cows look too skinny, you know. And so I kind of like to tell my clients that they're kind of like an Olympic athlete, and they're designed and they've been bred for thousands of years for a different purpose. It's kind of like comparing a greyhound dog to a Labrador retriever. Both have two totally different jobs, and thereby their conformation and their build and their body condition is different. She is at an ideal weight for a Jersey cow, and
So seeing her ribs is normal.
yeah, and in fact, if I don't see ribs, I'm going to probably think that dairy cow is overweight, and that comes with its own list of problems, and actually feet would be one of them. She's here today for preventative maintenance care on her feet, and we don't see that a lot. Usually we see after the fact when we're trying to fix things that should have been addressed, but obesity in cows can definitely lead to foot problems. In dairy cows specifically, it can lead to some medical conditions that are specifically attributed to overweight, and ketosis is what I'm referring to. And so she's ideal weight. Another thing, you know, just kind of self-education. If you're going to buy a cow, I think it seems like most of our homesteaders lean towards the Jersey because of the butter fat, their docile nature, and they're also not as big as a Holstein, so they don't consume as much as food, which is important. And they just seem, pound for pound, they seem to be the best homesteader dairy cow. Evaluating their bags, their feet, and then just their overall body condition, and really just drawing yourself attention to that when you go to purchase your cow. I would probably recommend against getting a cow that's been milked 3 or 4 times lactation. So in other words, she's had 3 or 4 calves. I probably would start like Kevin and Sarah did, get something that's brand new so you know what you're dealing with. If you're buying a cow that's already been milked for several years, it's probably for sale for a reason.
Right.
And there's a lot that we don't have time in this video.
We made all the mistakes the first time around, and we think we've done a lot better this time around. So,
She looks great. I mean, she looks like a really, really good, well put together dairy cow. There's a lot of resources on the internet for good conformation in dairy cattle, and she really looks pretty good. And she's raised a nice calf. That calf is only 7 weeks old. Yeah. 7 weeks old. So you can see that butter fat's really helping that calf.
Right.
Oftentimes I find that a lame cow, which would be a cow that's limping, the first go-to for some of our producers is to give the cow an antibiotic injection. I get a little frustrated because sometimes the cow has had 3 or 4 rounds of antibiotics, and there's really only one condition called foot rot that antibiotic is warranted for that will actually work. But most of the time there's some sort of abscess or some sort of anatomical defect with the hoof if they're limping. She's not limping, make that clear. This is just preventative hoof trimming, which is a really good idea. Jersey cows in general tend to have less foot problems than your Holstein cows or Guernseys, things like that. So basically we're going to we're gonna put her in our large animal barn, and myself and my large animal technician Levi, we're going to put her on a hydraulic tilt table that's non-painful. Sometimes they move around, and that's okay, but we're basically going to restrain her feet on the hoof trimming table so she doesn't hurt herself, and also she doesn't hurt us. And also we can do a proper examination of her if she's flipped over on the table.
Right.
And
so the table will basically squeeze her and then lay her on her side.
Right. So we'll put her in there, and then after she's done, then we're gonna deal with her calf. And Yep.
Now with him, are you going to band him today, or are you going to? You talked about maybe doing a different procedure instead of banding him.
Yeah, so there's two methods of castration in cattle. One is banding, which has been done for a long time, and that's basically a band that's put around the top of the testicles, and very quickly the blood flow and the nerve feeling to the testicles disappears because the blood flow is absent, and the testicles fall off within 2 weeks, maybe 3. He's, for being a young calf, he's a little bigger, and in my hands, I think I'd rather do a surgical castration. This is done under a standing procedure, a local anesthetic. We don't like to sedate cattle like we would, like if you have a dog and you take it in for castration, they're going to put it underneath anesthesia. Cattle, the way their digestive system is, they're a high risk to lay down to do an anesthetic procedure, and they can get rumen fluid and digesta come up and they can aspirate, and it's just not a good situation. So every surgery we do, including cesarean sections in cattle, we do standing with local anesthetic, and we like to get the calf in and out of the chute as quick as possible. We're going to give him a pain injection as well, a non-steroidal anti-inflammatory that lasts 24 hours. Pain equals stress, stress equals weight loss, could equal disease. So as much as we can reduce the stress on any procedure we do to an animal like this, the better off it is for everybody. So, okay.
Let's get Babe moved in, and
okay. I guess I'm going to go this way, Levi, and then you want to push her in. Normally, if it was a beef cow, I don't get in here with them. Dairy cows tend to be typically very gentle, but you do have to keep safety in mind, of course. But all right, I'll push her up for you, Levi. So Levi helps us on a lot of large animal cases, and does a lot of the hoof trimming work here in the clinic. Most of it, actually. And it's been very valuable to have a lot of hands. We have a few other vets in the practice too who help. So.
And I didn't mention, we are at the animal clinic of Ava, which is Ava is the town that we live in, and Dr. Mike is actually the owner of the practice.
So we're going to put this halter on her just to restrain her head. And Levi's going to put this here. We're going to tie her head against this so she's not hitting it against anything. So we're gonna flip her over on this table, and then we're gonna tie her feet after she's over. So. And even on this table, they can still nail you. So you have to be mindful where your face is and everything at all times. I'd say all of us have gotten hurt doing this more than once. And the less these feet can move around, the better off it is for the animal. Tie that. Okay. This could get a little wet here, so. Stand back. We wash the feet off, and then we'll go through and examine each one of the toes. Most limping cows, 90% of them, if they're lame or limping, the problem is in the feet, in the hoof. And then even to extend that further, probably most of them are in the rear leg, and then even go even further, it's usually the lateral claw. So the lateral claw means towards the outside of their body, looking away. So this is a lateral claw of the left rear leg, and this is a lateral claw of the right rear leg. So, I mean, almost all the time it's right here, and that has to do with just the amount of weight that's put on this particular claw or this toe. But you know, just kind of basic look at these hooves. They've got a little bit excess toe growth, not bad. Foot rot is something I mentioned out there. And that's the scientific or medical term is interdigital, means between the two digits, dermatitis, so it's a skin infection. And it usually occurs right here. and it's visibly, apparently swollen. This cow does not have that, but I'm just demonstrating that this is where foot rot would occur at, not the hooves, but the soft tissue. So just kind of looking at these, the hooves look symmetrical. They look the same size. If you see a hoof that's larger, or a toe that's larger than the other, or a claw that's larger, then there's an issue. The other thing we get, sometimes if they get too long of toes, they will actually start walking on their heel bulb, which this cow is she's kind of transitioning that way a little bit. Her toes are a little long. And when they start putting weight on these heel bulbs, these aren't meant to be weight bearing. The wall of the hoof is the weight bearing surface. This is the sole right there. That's some normal wear and tear right there, but that's not an issue, but we'll look further into that. But this cow, if left untrimmed, after a while she'd start getting like gravel pushed on here, and that gravel and sand and mud and all that, it'll start getting trapped in cracks, and then the hoof traps it in, and basically the only way it has to go is basically up, and then this is the joint space, and if they get a joint infection for an abscess that's untreated, oftentimes there's not really much we can do. I mean, at that point it's a salvage issue. And so this cow, even though she's not lame or limping, being that she's on the hoof table, these are hoof testers, and this is just monitoring her response. This is identifying pain in the hoof or hoof abscesses. So we usually just go through and check all the toes real quick. So basically we just go through and just test all of them. There's some hoof growth here on this heel bulb we'll probably trim just a little bit off. If this folds over, they can get dirt trapped in there and gravel. And that's where you get your lameness issues from, so. But all in all, she looks pretty good. One thing I wanted to show, you can see kind of a line of demarcation right there. I don't know if you can see that or not, if it's showing up. So we're probably not gonna be able to take that much toe off, but the reason there's a line is because there's increased pressure, and this could turn into like a stress crack over time. And if the toes start cracking at the ends, it's just because they're too long. So the goal of this is just and any hoof trim we do is to return the foot to the most normal conformation like they're supposed to be as possible. If we do get blood on a cow, it's not the same as getting blood on a horse or quick in a horse. Okay. They will be fine, and oftentimes we have to get in the blood supply to correct whatever condition they have. Okay. We're just gonna trim her feet real quick here, and usually I start at the heel on cows, and horses I start at the toe. And even though she's tied, she can send this hoof trimmer sailing. Look, Levi's done 2 and I've only done 1. I'm too busy talking. I use this to kind of grind the inside part of the toe because it can curl like this. And so you'll notice I did this on this one to kind of just curve it back, and I'm gonna do the same one on all these toes, so. Also, this allows us to kind of uncover any potential defects of the hoof. Like you see little brown spots, so that's worth investigating a little bit more. That didn't hurt her. She's just kind of getting squirmy, so we're just gonna investigate that. Looks fine, but this kind of gives you basically a fresh surface to look for any abscesses or anything like that. So this cow, she had a lot of heels, and these become kind of like bunions over time, or calluses, and they become painful. So she's requiring a little bit leveling off of the heel bulb here. and that's going to kind of get some of the pressure off the back end. Something that could be concerning here, that little bitty black mark right there. See that right there? So that oftentimes your abscesses start in the toe. But yeah, on cows, I don't really mess with this unless it's swollen, and then I may do that. But she's got this little black line here. We're just gonna, and there's no, where I'm at, there's no nerves. That's just her being kind of responsive. And so any little black lines, I just kind of dig out till I get into normal tissue. But something that small and simple can start out, and it can be kind of like the tip of the iceberg. So they have a normal concavity here in their hoof. That's perfectly fine. Most of their weight's put right in here on this surface. If I had a pen, I would draw it, but we try to kind of keep this concavity. And so I don't really get too, sometimes I'll dig up in here and they'll get little crevices, and we'll straighten those out and kind of pare them out. But all in all, she's got pretty good feet, really. So. So we had this little fissure that I was explaining that, and we got it dug out. And like I said earlier, if they bleed a little bit or you quick them in cattle, it's not that big a deal. In fact, it's oftentimes necessary to get to the bottom of the dirt line or the infection. And so this green material is basically a copper-based antibacterial, and it also helps harden the hoof and seal up any wounds like that. But that's really all I'm gonna do for her. I mean, sometimes, like in her, I'd like to take a little more toe off, but being that her quick was out that far, that's really as far as I wanna go, and maybe next time we can take a little more off. But all in all, I think she has good feet, and this is just like quicking a dog's toenail. It's a long ways from causing any problem with her, and like I said, in a few months, if not addressed, it could cause problems. So.
Is this something we should be having done at a regular interval? Like, should we bring her back in 6 months? Should we bring her back in a year? Or do we just judge?
I would say a year, but judging it also, and just kind of being aware of that she's too long in the toes and that those toes are going to start to break off. If you see something that occurs, at that point we'd probably go ahead and bring her in sooner. But it will vary, and as she gets older, it might be more often.
Okay.
And of course, seasonality. Sometimes the weather can affect these things too. Okay. You know, she done great, so we're going to go ahead and get her untied and let her down.
Okay.
You're good to go. Okay. We're going to do that so she chooses to go this way. And she's not in any big hurry for sure.
There you go, babe. Now, we used to castrate our own pigs when we had piglets. And on those, you just make a little slit, pop the testicles out, and just honestly just kind of pull them out. Is this a similar procedure, or what exactly will you be doing?
Yeah, it's very, very much similar. With a pig, you make two separate incisions.
Right.
On a calf, we make one complete incision that incorporates both the left and the right testicle.
Okay.
And then the difference between a calf and a pig is that they have a calf has a cremaster muscle. It's the muscle that I like to say kind of pulls the testicle up in the cold weather or what have you. And we basically break that muscle down so we can exteriorize the testicle.
Okay.
And then on a calf, you have to be sure and pull the vein, and it kind of stretches that vein very, very thin to where we can prevent bleeding and cause hemostasis, basically.
Okay.
Because if you just pull, you can break the vessel too quickly and they can bleed.
Okay.
And
so there really shouldn't be much blood at all on this.
No, and we evaluate that too. We're going to surgically castrate them. I'll numb them up first, and we're going to basically take each testicle out. Now, some people, Rocky Mountain oysters, you know, that's common around this part.
Nope. I will tell you, we eat a lot of things.
Well, since I'm putting lidocaine in here, you know, if you're going to do that, you wouldn't want to put lidocaine, you know, and so, but Anyways, that being said, I'm with you on that.
So you feel free to keep them.
No, I'm good. We'll go ahead and open this up and get him in here. And so he looks pretty content. I don't see any distress, and so that's exactly what we want. It's a nice time of year to be doing this. It's not hot, you know.
No flies around.
No flies, yep. So I guess we'll send them back home.
Come on. There we go.
Good girl.
Man, it's nice when it goes smooth.
Man, I love that cow.
And the calf went in too?
Yeah.
Wow. Well, thanks for bringing her in.
All right.
Thanks.
Thanks for
Yep,
thanks for answering
appreciate
all of
it.
our
Thanks,
questions,
Levi.
and thanks, Levi.
Well, we're home, safe and sound. I know that Babe and Ralphie are excited to be home.
I'm sure right now they're glad to be anywhere but the vet.
Exactly. So we're gonna let them out and reunite them with the steer that we moved in here. We named him Cletus, and they'll be able to just settle back into home.
All right, come on.
Come on, girl.
Look at you and your new feet.
That's right, come on. There you go, good girl.
Good girl. All right, Ralphie, your turn.
Good job. All right, you're home.
Well, this was quite an adventure for Babe and Ralphie today. I'm glad that we're back home. Everybody made it safe, but you know, all the folks, Dr. Mike and Levi and all the folks at our local vet, they always do such a great job. So thank you to you guys who helped out today. It's always nice that they take into consideration the stress on the animals.
Speaking of stress on the animals, now that they're back home, we just need to leave them alone. And they just need to, you know, relax and enjoy being home. It's stressful to be loaded up into a trailer and take to town and poked and prodded and stuff like that at the vet, and then come on back home.
Right. At least it's a nice sunny day. It's not super windy today, so they can just kind of hang out and enjoy the sunshine and enjoy the rest of their day.
You guys, if you're enjoying videos like this, we would sure love for you to hit that subscribe button. And also remember that the best way you can help us here on the homestead is just to share our videos on your social media. Until next time, thank you so much for stopping by our homestead. Take care and God bless.
God bless.